Talk about the best resources for USMLE Step 2 CK. So the best resource for USMLE Step 2 CK is just one resource, that's UWorld. If you have to do just one resource for USMLE Step 2 CK, I say that would be UWorld. And I think a good way to do it is just do 2 passes of it. That's more than enough of UWorld. But UWorld has all the algorithms that you need. So it has a lot of algorithms that's very high yield, and it's also gold. So very high yield. And just do UWorld, you'll be fine for USMLE Step 2 CK. I know people who have scored like scores like 284 and 281, and just by doing UWorld, there are people who have just like scored 275 without even touching any resources but UWorld. However, if you feel you need a little bit of more help, you can try out another question bank called Ambers. So Ambers is just like UWorld, but it has questions with a twist to it. So it has just the same kind of questions as UWorld, but it has a twist to it. Okay, all the questions have a twist to it, so it just makes it a bit of a harder question bank. But the thing with Ambers is it gives you extra practice, so it's pretty good to have extra practice. So you can try out Ambers. The third resource I would recommend for USMLE Step 2 CK is Anki. So Anki is pretty helpful for revising the algorithms that we just made. So it's very good for reviewing algorithms. And what you can do is you can get a pre-made deck. So you can get decks like there's this pre-made decks, like what I use is a Tease Anki. Then there are decks like Anki King. You can just choose whichever you like. These are pre-made decks for USMLE Step 2 CK, and all of them are kind of made from the same thing as UWorld, right? Tease Anki is also a combination of, it's a combination of UWorld and Ambers. That's Tease Anki. So you can try them out, but I love Anki for Step 2 CK, not so much for Step 1. The fourth, I think, resource that anybody can consider for USMLE Step 2 CK can be OME, that is online med-ed. But this is one thing I'll say you should keep as an optional resource, because what I've seen is online med-ed is an okayish resource. It's not that great, and it's nowhere near BNB. So I would literally keep it as an optional resource. It's just like if you feel that you want to review a subject, just like review one particular subject, you can do online med-ed. So if you just want to review one particular subject, just do it from online med-ed. It's anyways free. However, if you like really, the thing you will feel is online med-ed is not enough, because it doesn't cover anywhere near stuff compared to UWorld. So I would tell you just skip it. But if you really feel the need to have a video resource for Step 2 CK, go with OME. There's no other better resource than OME. But however, you can totally skip it if you want. There's another amazing resource for USMLE Step 2 CK that you can try out, and that's Divine Intervention Podcast. So this is actually a website. You can just Google this, Divine Intervention Podcast. This guy is like a radiology resident who's making a lot of podcasts regarding USMLE Step 2 CK, and these seem to be amazing because I've heard a lot of good reviews about Divine Intervention Podcast, and a lot of people use that. So you can try out Divine Intervention Podcast. I have heard a lot of praise about this. Right now we're just going to talk about USMLE Step 2 and how does USMLE Step 2 differ from Step 1. So right now I'm just going to tell you about the USMLE Step 2 question pattern. And I'm just going to differentiate it from Step 1, okay, from Step 1. Okay, so the USMLE Step 2 question pattern, how it is it actually builds upon Step 1. So it is somewhat derivative of Step 1, but it is the next level of Step 1. Like literally it's just the next level of Step 1, and you will understand as I tell you how this works. So the second thing that's important is it's just like Step 1, but there are less clues. So in Step 1 there are so many clues, like they'll give you so many clues towards the answer. In USMLE Step 2 that's not true. It's just that the number of clues decrease compared to Step 1, and that makes for a tougher exam. Also it is a lot more vague, meaning it's compared to Step 1 where like they will give you, let's say, starry sky appearance. Okay, if they give you starry sky appearance, that means Burkitt's lymphoma, right? So if you get a starry sky appearance, that means Burkitt's lymphoma. In step 2, they don't do that. They don't give you buzzwords like that a lot. They might give it, but the number of buzzwords, I think, go down. Number of buzzwords. Not only that, the DDs that are there, like differential diagnosis, are very close to each other. For step 1, the DDs were not that close to each other. For step 2, the DDs are so close to each other that you have to have very strong test taking skills to score good on step 2. And since you already know that USMLE step 2 is about clinical knowledge versus step 1, which is about basic sciences, step 2 CK is a lot about algorithms. So remember that out, I'll write it down. Step 2 is a lot about algorithms, meaning you have to know what's the algorithm for cardiopulmonary resuscitation. What is the cardiopulmonary, what is the algorithm for ACLS? Okay, you have to know all of that because they can question you on the algorithm. Okay, that's very important. Another thing that's very important for step 2, for you to know for step 2 is step 2, the most common questions that you get are questions like the next best step. Okay, the reason the next best step questions are so confusing is because the next best step can be so many things. Okay, the next best step for a patient can be either be diagnosis, okay, or it can be treatment. However, sometimes it's very hard to determine whether is it diagnosis or treatment, and you need to have very specific knowledge to know what is what and what comes first. I'll give you an example. Let's say a patient has something like peritonitis. For peritonitis, we immediately jump to treatment. We do not wait for diagnosis. We immediately jump to treatment and we just open the abdomen up. We just start with surgery immediately. There is no diagnosis we do for peritonitis. It's just a clinical diagnosis. That's what we do, and we immediately jump to surgery. But let's say if you have something like sepsis, what we do for sepsis first is we do blood cultures. Okay, but we do not wait for the results of the blood cultures to come. We immediately start the treatment, that is we start with IV antibiotics. So that's very important. Okay, we give prophylactic antibiotics, but understand we do blood cultures before that. Okay, so that we can detect the organism before we can give the antibiotics. Okay, so that's how blood cultures are effective if you give it before, if you have it before the antibiotics. But the results of the blood culture come later than when you start the antibiotics itself. So results come later. Okay, so that's something you have to know, right? So this is all about the next best step. Step 2 is about understanding what should you do next. Should you do the diagnosis? Should you do the treatment? Should you treat maybe some other condition? If the patient has a problem in ABC, that is airway, breathing, circulation, you always treat any problem in ABC first, that is airway, breathing, circulation. Airway meaning like if the patient is not able to, the airway is not patent, you give endotracheal intubation. So you do endotracheal intubation, okay? And so I'll just write it as EI, endotracheal intubation. And when you do, when there is a problem in breathing with the patient, let's say the patient has a problem with breathing, what we do in this regard is we look at the oximetry, pulse oximetry, and we look if the oxygen is low, we can start things like CPAP, or not CPAP exactly, we can start things like PEEP. Maybe we can start mechanical ventilation to stabilize the patient. And if the circulation is problematic, we can give IV fluids if the patient has hypotension, or we can give things like CPR if the patient has cardiopulmonary arrest. Okay, cardiopulmonary arrest. So you do ABC before anything like even diagnosis or treatment. If ABC, if you see a problem in airways, breathing and circulation, you fix them, then you jump to the diagnosis and treatment. There are exceptions to this, and you will learn it. There's one exception for tension pneumothorax, where you treat the tension pneumothorax through the needle thoracostomy before doing the ABC, because fixing the breathing through mechanical ventilation, the breathing through mechanical ventilation will exacerbate the pneumothorax, that is tension pneumothorax. So we give needle thoracostomy before that, but ABC is generally the first thing we do before even diagnosis and treatment if there's a problem in the airway, breathing and circulation. So remember that. Another thing that's very important to know is what other questions you are going to see is the most significant risk factor questions. Okay, so what they'll give you is they'll give you a patient, and let's say the patient has eclampsia. Okay, what are the, and they'll give you in the answer choices the risk factors for eclampsia. Okay, and what you will see is there'll be one risk factor that will be above the other risk factor. Let's say if the patient has previous eclampsia, okay, this is the biggest risk factor for having eclampsia compared to even hypertension. Okay, and these can be other risk factors for eclampsia, but understand that they can ask you questions like the most significant risk factors. Then there are but the most common question you will see is the next best step questions. Okay, that's the most commonly seen. The eighth kind of question that they can ask you are like diagnosis question, like just diagnose the condition. Is it pleural effusion, okay, or is it atelectasis? Okay, those kind of conditions they can ask you, but this is very rare. What you will see is the next best step questions, and that's the way to solve these is to learn algorithms that UWorld teaches you. So you learn this from UWorld. So this is how USMLE step 2 operates in a small picture, and I hope you got the general picture here.